Hi, my name is Lisa Argabright, and I'm a nursing student with the University of Charleston. And the purpose of this video today is to describe IV access and medication administration through infusion and such. I would like to start this video by stating that before you perform any of these procedures, you should always perform hand hygiene by washing your hands and always wearing gloves. Every time you enter your patient's room, you should pull the curtain and provide privacy and identify your patient. Have your patient state their full name, their birthday, and you can also check their identification bracelet for their name and their birthday. You can check their patient number on their wristband, and there's a barcode to scan as well to verify that you have the correct patient. To be able to give IV medication or infusion, you need IV access. To obtain IV access, you would have a start pack, which consists of a tourniquet and an IV dressing and an alcohol pad and a 2x2 and some tape. You want to have your hep lock and your saline flush, and you remove your cap from your saline flush. You never want to touch the ends that you connect because it contaminates them. You want to connect your saline flush to your hep lock, and you want to flush to make sure you have no air, no bubbles in your tubing. Once you've done that, you don't want to uncap it because this will contaminate it as well, but you can kind of loosen it up a little bit so it's not as hard to get off. Once you've done that and you have all your equipment prepared and you're ready and you're at your patient, you want to select your appropriate IV catheter size according to what type of medication or infusion they may need. And for this video purpose, we have Mr. Apple. To obtain your IV access, I've done this prior to this video because IVs don't really insert very well on apples. You want to hold your IV at an angle and you want to insert. Prior to doing this, you want to apply a tourniquet 3 to 4 inches above your desired IV access site. You don't want to put it too close. And you want to clean the site with an alcohol pad. You want to start in the center and you want to work from least contaminated to most contaminated in a circular motion. Once you've done that, you want to insert your IV catheter and you'll feel a pressure change, and you should be able to see blood in your, it's called a flash. Once you have blood in your flash container, you want to slightly advance your IV needle just slightly forward. Once you do that, you want to advance your catheter until the hub is all the way to the patient's skin. And you want to occlude that so that they don't bleed out the end of the hub. And then you retract your IV needle, and you always dispose of this in a sharps container. Once you have IV access, you want to take your flush and connect it like so. You twist it on there. And you want to aspirate and look for blood return in your tubing and flush it. As you flush, you want to feel for any, not working out. You want to feel for any fluid buildup under the patient's skin where your vein might have blew and it may be infiltrated. Once you've confirmed that you have placement, you want to secure your IV using tape. You want to apply your tape to your IV catheter hub. You don't want to tape it over your hep lock in case you have to switch this out later, which we'll discuss momentarily. So once you have that secured, you also have some form of dressing cover. You want to take this, lay it over top of the hub. You don't want to cover up, once again, in case you have to change it. You want to pinch it around and kind of smooth it out so it's secured. Once you have it secured, you can detach this, tape this to the patient to secure it as well so it's not hanging. After you have IV access, there's many things that you can do with this. Importantly, when you're not using the hub, you want to clean this with an alcohol pad and replace the cap over the end of it when it's not in use, so that it doesn't become contaminated. Okay, that cap doesn't fit on there. Okay, if you had one that fit. So once you have that, you can give medications. When it comes to giving an IV medication bolus, you always want to check your doctor's order. You want to go obtain your medication. You want to verify your medication 2 times. Take all your medications and your equipment that you gather into the patient's room. Once you're at the patient's bedside, you want to pull up your MAR again. You want to scan their wristband, make sure everything matches, and verify your medication for a 3rd time. At this point in time, and any time that you go to give any medication to a patient, you want to make sure you have the right patient, the right drug, make sure it's the right time, the right route, the right reason, and you're going to look for like the right response. You always want to check your right R's of medication. So when it comes to drawing up medication, you would take your cap off of whatever medication you're given. You would want to clean the top of it with an alcohol pad. You want to obtain a needle, attach it to a syringe. You want to insert your needle, draw up your medication, make sure you have the correct dose. Once you've done this, you can remove this needle, place it in a sharps container as well, and you have your medication. You want to remove the cap from the end of your hub, clean it with an alcohol pad, and you twist it on, administer your medication, twist it back off, clean the hub, and always put your cap back on the end of your hub. So that's for giving IV boluses. If you want to give an IV infusion of, let's say, normal saline or some other type of fluid or IV antibiotic or such, we're going to use normal saline in this instance. You always want to check the date, which is expired, as you can see. You always want to check, make sure that it's, a good collar, you don't have anything floating in there. You want to verify that it's the right medication, and if it is the medication, and compare it to the MAR, same as with an IV bolus. When assembling your infusion, you need a drop set for your patient as well. When doing this, you want to prepare it. You want to remove the end cap from everything. Use a twisting and pushing motion. You want to hang it up somewhere. You want to squeeze your drip chamber so you can see it drip. And you see all these air bubbles in your tubing. You do not want that. So you want to run it until you have all the air bubbles out of your tubing. Once you've done that, you want to close your wheel back off. And uncap the end of your tubing. And you would hook this in as well.